Well, this is so easy. It's odd that I have not done this yet. Hey there. So, this is the thigh, this is the leg. Oh, so confusing. Anatomy. Always weird. Yeah, I know. The whole thing is the leg. In colloquial English. In anatomy, we want to make everything extra complicated. This is the calf. You all know there's this twin muscle gastrocnemius. Sadly weak in me right now. Thank you, stupid brain injury. Couldn't exercise for a long time because I would always get so dizzy. But, well, if that wasn't the case, you would see like these two muscle bellies here. And they have these two tendons that then, right below the knee, get into the pit of the knee and then attach right above the knee, which is where they cross over with the hamstrings tendons, and these two come here. We don't need to get into more specifics. I mean, of course, you can always look at all the pretty anatomy pictures. Just look it up. Hamstring tendons, gastrocnemius tendons, and then you'll see. And then you'll see also how complicated it gets here, because there's a lot of blood vessels, nerves. But what massage therapists learn is an endangerment zone. That's really just like here in the pit of the knee. And if you poke in there a little bit, you will notice that even if you're weak, like I am right now, I mean, I don't know how to endanger people here. You would have to hit in there with a hammer or something. So don't be scared, okay? As long as you go slow, nothing bad's gonna happen. So this is very easy self-treatment when you have any kind of misalignment issues around the knee and you just want to experiment and see what you can do yourself if you don't really have a skilled manual therapist right now. So the first thing I want you to do is just feel for the plateau of the tibia. Now I'm going to be like, Lou, what are you talking about? Don't worry about it. Just get to the bottom of the kneecap in the front. I'm going to be like, Lou, I don't see what you're doing. You're not going to see what I'm doing if I turn the phone around and whatnot, and that's too complicated right now. But just get an idea what's going on the bottom of the kneecap, and then just wander around where you can feel something. Just be brave. Be willing to be wrong. So the tibia plateau is below the kneecap, and you feel like the tendon under the kneecap. That's the patella tendon, because patella is the formal name. And then you also know that what you feel coming more towards the thigh, those must be the epicondyles of the femur. Epi means above, so the tibia has condyles, the femur has epicondyles, because those are the above the condyles. Actually, the anatomical Latin is often surprisingly easy. It's just a description. So as you come around here with your two fingers, you're gonna hit these hamstring tendons, and they feel like these big strings. And you're gonna feel here on the inside there's actually two of them. So whenever you run into one of these big strings, what I want you to do is differentiate them. That means you want to get on both sides of them. Now you don't need to do that on both sides at the same time. You can just get in on the one side and then get in on the other side. And then you try to really bring your finger under. And then get in on the next side. So wherever you feel this big rope, you just try to separate it from its neighbors. And where you feel two here, you really try to get in the middle of them. And then you get below and you do the same thing. And you may really feel this crossover here. And the more often you do that, don't do too much too long. You don't want to cause like inflammation, and you don't want to just like poke into the skin. If you can't move the skin around as easily as I can here, then the layer that's available for treatment might really just be moving the skin over the superficial fascia. So don't force your way in if this is not mobile like this. Because if you have some swelling going on there, if there's long-term irritation, sometimes anything that's available for treatment is just like this top layer. So that's what we say when we say, first we have to differentiate the layers, and then we can differentiate the structures. So the structures, in my case, are already the tendons. And these are the medial parts. Gastrocnemius comes from here. Down there's where my foot. Up here is my thigh. And so this is the medial side, meaning this is towards the midline of the body. This is the lateral side. Now here, this is just one big tendon bundled towards hamstrings. And again here, one gastrocnemius tendon. Gastrocnemius is like this twin belly muscle. Down there it goes into the Achilles tendon, it's just one, and then it splits apart. So here, hamstring, here, gastrocnemius, here, very interesting crossing over part. Now if you don't find crossover, doesn't matter. Today, the layer that's available might really just give you the fascia that goes around both of those. And you do it on the next day, and then you might be getting a little bit deeper. Don't be scared of the area in between just because I said this is an endangerment zone. This is what they teach people in massage school, so that nobody will sue them if additionally they cause some nerve irritation. Sometimes it's a good idea to just see what you find. Now, if you go slow, you will feel whether there's anything particularly sensitive. Does that look gross? A little bit, huh? Well, I haven't really been on the sun either. This is the most pathetic time of my life, so be grateful that I still show my pale yellowish skin off. But you already get an idea, right? Don't worry too much about it. If it's all inflamed and sensitive, it will tell you so, and then you can say, hey Lou, this doesn't work. Show me again how I can work the most superficial layers. And then I will tell you, well, I'm sorry, it's going to be the most boring type of massage, because sometimes all you have to do is this. It's as if you have kind of a loose sock, and you want to move that loose sock just very carefully so that it doesn't do any wrinkling over your leg. So that would be what you do if it's all inflamed. Just like that. Now that's what you do when you don't feel any tendons. These feel like really tight ropes made out of loads of strings of wire. Good luck, let me know.